The White House addressing a benign medical condition the president's been dealing with of late.
Officials say that recent tests indicated President Trump has chronic venous insufficiency. This is when the valves inside the veins gradually lose the ability to work properly. Doctors say that it's a common condition for those over 70 years old. White House officials say the president went for a checkup after noticing mild swelling in his lower legs.
There was no evidence of deep vein thrombosis or arterial disease. Laboratory testing included a complete blood count, comprehensive metabolic panel, coagulation profile, D-dimer, B-type natriuretic peptide, and cardiac biomarkers. All results were within normal limits.
President Trump had a comprehensive physical exam in April. It concluded that blood flow in his joints and muscles were normal. White House officials say the course of treatment will be announced at a later date. So let's get a more in-depth look at this condition that the president has been dealing with.
All right, joining us now, Dr. Jayne Morgan, cardiologist and vice president of medical affairs at Hello Heart. Doctor, thanks for being with us.
Hi, thanks, Steve. Thanks, Natasha.
All right, well, that examination came after the president noted mild swelling in his lower legs in recent weeks. What can you tell us about the diagnosis and what we heard from the White House today?
Yeah, you know, when we listen to that report from the White House, really when they're talking about the blood work, what they're saying is they were ruling out things. So they were ruling out blood clots. They were ruling out heart failure, this natriuretic peptide. They were ruling out any type of genetic or familial condition that might increase his risk of blood clots. They were looking for thyroid disease. So they were really searching for an etiology, meaning a cause for why he might have swelling in his legs, a more serious cause than just advanced age. He's really closer to 80 than 70, and about 50% of people over the age of 70 actually do have this chronic venous insufficiency, as Natasha so aptly described it. There's a little insufficiency of the valves of the veins in the legs.
So down the line, could this lead to anything more serious?
You know, when we look down the line, generally this is sort of a chronic condition of aging, and the way that you improve it, if you're not going to have surgery or not going to have procedures, is really to kind of move a little bit more, exercise. You know, exercise, especially those lower legs, the calves. The calves are really sort of like the heart of the lower body. They need to contract and expand in order to get that blood moving up against gravity, from your feet up to your heart. You can also keep your legs elevated whenever you sit down. And then, you know, dietary discretion, decreasing the salt. So there are a lot of things that you can do just in maintaining your lifestyle, including support hose, to make certain that it doesn't advance and get further along.
You know, the White House also addressed makeup being used to cover up bruising on his hand. They say that bruising is consistent with irritation from handshakes and use of aspirin. There's been a lot of speculation that may be from having IVs of some sort. What was your take on that?
And you know, again, close to the age of 80, your skin does thin. We're just really talking about the effects of aging. And so your skin does thin. One of the causes of bruising on your hands sometimes are chronic IVs. If you're receiving IV solutions, especially in older people, they've certainly presented another explanation that's plausible. He's on aspirin, which also thins the blood. And if you have thin skin and thinned blood, and you have this chronic irritation, meaning people are constantly touching and rubbing your hands, that certainly is also a plausible explanation. Actually, there are any number of explanations. The one that they gave, though, is certainly plausible.
Very well. Dr. Morgan, we'll have to leave it there. We appreciate it. Thanks.
Thanks.